So the question for meningitis reads, Mr. Mark Kombe, a 34-year-old security guard at Heshima Supermarket, is admitted to male medical ward in an unconscious state after complaining of fever and severe headache in the last 5 days. On examination, there is neck stiffness and a provisional diagnosis of meningitis is made. Question A says define meningitis. Question B says state 5 signs and symptoms of meningitis. Question C, describe the management you will give to Mr. Mark Kombe from his time of admission to discharge. And question D says state 5 possible complications of meningitis. So we'll start with definition. We can define meningitis as this is a central nervous system condition in which there is inflammation of the brain meninges covering the brain and spinal cord caused by bacterial, fungal, or viral infection characterized by loss of consciousness, neck stiffness, and fever. So when we talk of defining any condition, especially conditions that are specific to a particular system, you always have to mention the system, and in this case meningitis affects the central nervous system, and in this central nervous system the meninges, which are the membranes that cover the brain and the spinal cord, are the ones that are inflamed in this condition, and the inflammation is either caused by bacterial infection, a fungal infection, or viral infection. So one of these 3 bacteria may enter the central nervous system and cause inflammation to the meninges, causing meningitis. One of the characteristics that we can see in meningitis is that there may be loss of consciousness or altered level of consciousness. Sometimes the patient may not have collapsed into unconscious state like our scenario. Sometimes the patient may be fully conscious where they can talk, but they have an altered level of consciousness where they act as though they have become mad or confused. All those symptoms are symptoms indicating altered level of consciousness seen in meningitis as well. Apart from that, it could be neck stiffness. This is because inflamed brain meninges affect or impairs transmission of electrical discharges or impulses, and this may cause stiffness of the neck. And also fever will be seen because of presence of the microorganism in the blood, which can either be bacteria, fungi, or the virus. So in terms of defining meningitis, that's how it is defined. Then question B from the question we looked at said 5 signs and symptoms. Now amongst the signs and symptoms that we can see in meningitis, of course this includes fever. Now fever, this is due to presence of the bacteria, fungus, or virus in the blood. When the question says state, it means that you have to give a reason to your answer. You don't have to leave the questions hanging. You don't have to list them, because when you list, when the question says state, it is a 0, because an answer without a reason is not an answer. So when we talk about signs and symptoms, that is the first symptom we can see. The other symptom we can talk about is headache. Headache is due to increased intracranial pressure. Because of increased intracranial pressure, remember when the virus, bacterial, fungus enters the meninges, it enters the brain through what is known as the lateral ventricles. And that is why when a question for meningitis comes, you need to have a picture of the CSF flow in your head, because sometimes they may ask you to draw the cerebrospinal fluid circulation and explain how it flows. So headache in meningitis comes in because of what we call the CSF, and the CSF is produced at lateral ventricles, and there are 4 ventricles in the head. So the lateral ventricles are the ones that are on the side, and this is where CSF is produced. Now when there is invasion of the bacteria in the brain, the bacteria is also going to cause overproduction of CSF from the three ventricles. This is because after CSF is produced, it will pass through the third ventricle and go all the way at the fourth ventricle. So at the fourth ventricle, this is when our CSF circulates through the meninges of the brain, and then it also continues down the spinal cord. But because of overproduction of CSF from the two lateral ventricles, it will cause overaccumulation of CSF between the meninges and the skull. So this will compress the brain tissue, and this is why we see severe headache. We also see neck stiffness, vomiting. All those symptoms are seen because of increased intracranial pressure. So that is how come we see headache in meningitis. The other symptom that we see is, of course, neck stiffness, which you have mentioned, and due to meningeal irritation, loss of consciousness, also due to inflammation of the meninges, increasing the intracranial pressure. Apart from that, positive Koenig's sign due to meningeal irritation. So when we talk about Koenig's sign, this is where the patient, when you make the patient lying in supine position and you lift the neck, the head should be also pressing on the mattress. But when you lift the head above, the legs rather are going to fold to 90 degrees. Then when you drop the head, the legs also drops. So that is known as a positive Koenig's sign. And this happens because of irritation of the meninges. Then when we talk of Brzezinski's sign, again, you are going to make the patient lie in supine position. Then you make the patient fold the knees. You fold the knees rather to 90 degrees or to the abdomen. Then you try to straighten the legs. So when you try to straighten them from the 45-degree angle or whatever, you have struggles stretching the legs straight when they are lying flat. This is because there will be that resistance that will feel like you're trying to stretch a metal bar when it's a human being, and that is an automatic resistance because of irritation of the spinal cord. So when you see that sign, then we call it as a positive Brzezinski's sign. Then the last one is, of course, photophobia due to irritation of the optic nerve. So when the question says state, you need to give a reason to your answer. If it is clear, we go to question C. And question C was saying describe the management. Now when a question says describe the management, you have to start from medical management, then you go to nursing management. But when a question specifically says describe the nursing management, you are just talking about the nursing care alone. You're not even talking about investigations. And the reason is simple. Nursing care does not depend on whether the diagnosis is correct or not. Nursing care depends on the symptoms that you can see, whether you know the condition or you don't know, and that is nursing care. So that is why when you are writing the nursing care, it is not necessary for you to talk about investigations, because investigations are part of medical treatment. You cannot treat something that you don't know, and that is medical treatment. So that is the difference between the two. So in terms of investigations that you can do in meningitis, you can get history, and history will review sudden onset of headache or neck stiffness. You can do physical examination, and the Brzezinski sign and Koenig's sign will come out positive. You can also do magnetic resonance imaging, and this will review meningeal irritation. You can also do a computed tomography scan. It will review inflammation of the meninges. And of course, full blood count will show presence of raised white blood cells. So on investigations, all you need is just 5 points. Then once you have 5 points on investigations, then you talk about the treatment. Whether the cause is bacterial or whether the cause is fungal. This is because only fungal and bacterial meningitis can be medically treated, but viral meningitis we just treat symptoms, then we hope that the condition disappears. And the good part is that the prognosis of viral meningitis is very good. But when you look at bacterial meningitis, the patient can easily die even with treatment. And also fungal meningitis, the patient will need to be on treatment for the rest of their life, because fungal meningitis usually is difficult to get rid of 100%. So they will need to be on maintenance doses. So now in our scenario, we are not sure of the cause, meaning that on treatment, at least mention one antibiotic and one antifungal and an anti-inflammatory drug, because we are not sure from the scenario, they have not specified. But if the scenario specifies that the patient has bacterial meningitis, it means that on treatment, you are just going to mention antibiotics alone. But in our scenario, because the cause is unknown, in terms of treatment, you can still give ceftriaxone 1 gram IM or IV OD for 5 days. And preferably we give it IV because it's more painful than benzylbenzathine. That's why preferably in the hospitals, ceftriaxone is given IV, but you can also give oral. Rather IM. Same as the paracetamol. Right now we have paracetamol IV, and when you tell someone to give paracetamol IV, they will even laugh to say we have never heard of such. But these are things that are there. Of course, when you mention a drug, talk about the mode of action, talk about the side effects, talk about the nursing implication as well. If the cause is antifungal, you can give amphotericin B. And amphotericin B, we are giving 1 milligram per kg body weight IV infusion over 4 to 6 hours. And the mode of action of amphotericin B is that it damages the sterols found on the fungal cells, and hence it is also known as a fungistatic drug. And of course, for each drug you mentioned, talk about its side effects, at least 2, and at least 1 nursing implication. Then the third drug that we talk about is an anti-inflammatory drug to reduce inflammation, and preferably the systemic corticosteroid that we can use is dexamethasone. So dexamethasone 10 milligrams IV initial dose, then 4 milligrams 6 hourly for 2 to 10 days. And dexamethasone, it's a corticosteroid which will help reduce inflammation. At least mention 2 side effects and 1 nursing implication. So once you mention at least 3 drugs, then you are ready to move on to the nursing management. But at least read through. If they have specified that it is bacterial meningitis, you can still give drugs like doxycycline. You can still give drugs like ciprofloxacin and also benzylbenzathine penicillin. So any of those 3. Again, if they specify that the cause is fungal meningitis, apart from amphotericin B, you can still also give nystatin. Apart from nystatin, you can also give fluconazole as well. So if they specify the cause, it means that on drugs we can also specify. Give any drugs that are specific to the condition, and also 1 anti-inflammatory, which is preferably dexamethasone. So that is about on treatment. Once you mention 3 specific drugs, then you are ready to move on to the nursing management. Now, when you look at the nursing management, the scenario said that the patient is unconscious. It means that you are going to take this as an emergency. However, if the scenario does not mention that the patient is not unconscious, then you just use general nursing care, which is a prophenema. You are also not going to apply infectious outline, because meningitis is not classified as an infectious disease, as a notifiable infectious disease. Hence, you will not use the infectious management outline. So it's either you are using general nursing care, meaning that the scenario has not mentioned that the patient is unconscious. But our scenario said that the patient is unconscious, hence you use the emergency outline. And you start from airway, you say patient resuscitation, airway, you talk about breathing, you move on, talk about circulation, talk about the environment, talk about position, points that you talk about on position, then talk about observation as well, interventions that you do on observation, psychological care, you talk about hygiene, of course, talk about the nutrition, you talk about exercise, you talk about medication, and of course elimination. So this is the emergency outline that we have used in even other medical conditions that are emergency in nature. The outline is the same, and also you find that they are also similar. And of course the last heading that you can still talk about is advice on need. So when we talk about of meningitis based on our scenario, you are using that particular outline. Question said, identify 5 complications that a person with meningitis may develop. Amongst the complications, one of it is hypostatic pneumonia. Hypostatic pneumonia may be seen because of prolonged immobility and also aspiration of vomitus. So we may see hypostatic pneumonia. The other complication that may be seen is blindness due to compression and inflammation of the optic nerve. The other one is hydrocephalus due to blockage and absorption of the CSF as a result of inflammation. So you see that the patient will complain of severe headache, the eyes will bulge outward because of the excessively increased intracranial pressure resulting in hydrocephalus. Epileptic seizures, so prolonged meningitis may damage the ability of the meninges to conduct electrical impulses, and this may easily result in epileptic seizures. And one of the causes of epilepsy is meningitis itself. So this is just caused because of inflammation and scarring of the meninges. And the last complication is respiratory failure. This is due to brain hernia causing neurological damage. So sometimes because of increased intracranial pressure, there may be herniation of the brain tissue, and this may take the patient into respiratory failure because of compressed respiratory centers. So when we talk of possible complications, you can see these are some among others, including hearing loss and also a stroke, which is cerebrovascular accident. So these are possible complications that we can see